Yes, sir.
All right. Right away, I see a shoulder dysfunction and weak hips. Hmm.
Can you
We,
see where his shoulder blades point out the back of his shirt? Look at the clothing. The clothing is literally draping off of his shoulder points or the
hmm.
tips of his scapula. That one a little bit. Go. I show you. You're really close. It's right here and right here. Yeah, I mean, this is a fun thing. You see how like
Okay.
the fabric drapes for you. You can see it. So right here is the tip of one shoulder blade,
Yeah.
and there's the tip of the other one. And those tips need to be like both here. Hence bringing the shoulder blades back down and around. But sometimes clothing can be a very helpful thing when you're trying to figure out what's going on.
So
Because
we
it
have a left shoulder elevation. We got cervical flexion here. Head's falling off the body.
and that's a combination too. It's a cervical extension and flexion, right?
Yeah.
His neck is in hyperextension in the sense that if it was in hyperflexion, he'd only be looking at the floor. So he's got a two-part issue, right? Which is his head is forward. So the only thing that can hold that up is all the muscles on his neck and his trapezius.
Yeah.
And that creates what I think I've heard you call like the turtle shell. But it's the head is driving this gentleman strongly. And if we can get his head back up over his body, and ironically, it's going to go all the way down to his feet. So once his head is in the right position, his feet and his legs will straighten up.
Yep. And we got a hump forming here.
Well, we call it kyphosis. A dowager's hump is actually a little bit more pronounced,
Yep.
but that hump, if you're going to call it a hump, we're going to call it kyphosis, right?
Yep.
He lacks extension in his spine, and it's pulling on his back.
Yeah.
I mean, did you know that the head can weigh almost 30 pounds? And the further it goes out there, the more
Yep.
it weighs. So I had
Yep.
a teacher that used to say, if you can't figure this, if you've ever remember our friend who would have a stick with the kerchief, the hobo guy, and like, the more he carried back there, that more that kerchief would pull the whole situation back. That's what our head does. I mean, essentially, our spine is a stick and our head is very heavy. So for this particular person, helping their head will open up their thoracic, that kyphotic area. That's a lot of upper trapezius neck muscles. Just no lower trapezius, mind you. Just a lot of upper trapezius, levators.
Put this man in static back would probably feel lovely. Although
With a book.
he would need something here, a towel or something.
Yes, sir. And you might get that as a levator stretch. Sometimes our program might call it levator stretch. The levators are these muscles that are right here that when someone comes up behind you and starts to rub it, you're like, oh, thank you. Thank you.
Yeah,
Thank
yeah,
you.
yeah,
Levator, elevator, ways to think of it. They go up and down. They make your shoulders go up and down.
yeah.
And you can see he has a rotation, which you showed in the shoulders. And if you're not sure, you can look at it's all through his body. His right foot's forward, his left foot's back. His right arm is kind of back, but his left hand is forward. His left ear is forward and his right ear is back. So he's a zoom, zoom, zoom. He's a zigzag.
Yeah.
I always look at the ears. I really appreciate it when people send pictures of the ears. The ears are your skull, guys.
Yep.
So it starts right there for him. Yes. So you were very observant of his shoulder being high on the left side. And it starts because look at the space between the shoulder and the ear on the left side.
Yep.
That's like just small compared to the other side. I'm just
Right.
saying small. I'm not going to try to measure it. And then you got to stick your head out there and put a rotation on it. And
Mhm.
yes,
Yep. And look at these knees.
that's an imbalance for sure. I bet yeah. I mean, they're externally rotated, the right one much stronger than the left.
Yep.
So that tells us an imbalance. I mean, we can try to name it a million things, but they're definitely doing two different things. He'd be a good tower guy too.
Yeah.
A little bit, maybe not straight away. It's always interesting. We might just do a standing groin stretch and it might take care of it all.
everyone loves the tower or a standing groin stretch. Or yeah, supine groin is
Mhm.
fantastic.
He's he has a wide shoulder girdle for a little pelvis, you know, kind of that shape of man.
Yeah.
And when the shoulders fall forward, for men, you guys get more L4 situations and rotator cuffs. Most women get SI and L5. It has to do with just that pelvis shoulder center of gravity situation.
And look, we can see his hand almost perfectly because it's so rotated.
Yeah.
His shoulder is just
And it's in front of his body.
right.
So when you look at that, right, you're like, wow, that arm is really just not connected to his backside. And that's kind of what's happening there, right? It's rolled forward. Maybe he's a mouser. Maybe that's the left hand mouser. I'm not sure. But he has a rotation. He'll feel much better after he gets rid of that rotation. I'd love to stick him in a windmill, just, you know, like stick him on the wall, get some side bending going. A lot of times people are very surprised. They're like, oh, I just did some side bending and everything's working out. Yes, because if one side goes, the other side goes, all the body dynamic tension. If one side is happening, the other side's happening.
I've never seen an elderly person do windmill. Obviously, you
Really?
have.
Sure, windmills are great. Why would an elderly person not do a windmill? Yeah.
they like they like static back.
Hmm.
We all
Static
like
back
static.
to windmill to gravity drop to static back to windmill, gravity drop. Gravity drop would be great for him. We could do fine if we didn't want to. I would love to do that with that. That would be great. Windmill for a lot of people, the hardest part of it is finding a wall with nothing on it.
Right.
But we could do them in a chair. But I mean, the strength there is you can really see the right toes. I mean, I really looking, if you really look there, his right toes are gripping the floor. They're even white knuckling a wee bit. I mean, I see everything.
Right here, right?
Yes. It's like I already know he's in trouble. This was to grip the floor like that. He's just standing there. Look, you know how much work his toes are doing right now to hold up his head.
Wow.
So that's when I say little things like, tower or straightening up. Maybe maybe it's not the tower, but if you start tracking that, right, you can do these in your own body. Grip the floor with your right toes, pull up your leg really tight. All of a sudden you're like, wow, my right side is really doing a whole lot of things and my left side is responding. Oh, that looks
Like
about right.
what you just said is powerful, and I want the audience to really understand because the body's a whole unit, and what you just
Always.
said magnifies that look how much his toes are gripping the floor to
Mm-hmm.
hold up his head.
Mm-hmm.
That's, no pun intended, over so many people's heads right there. Like toes gripping floor to hold up head. Wow.
Think of it, if you can't imagine, when we fall, which is more seniors worry, you can think of it maybe that way if it's not resonating with you. Because if your body has a head forward position, it has a sensory mechanism that you are falling, right?
Right.
If your head is way out in front of your body with no direction, and I say that because sometimes people are like, oh, I should never put my head out here. No, when you're thinking about it, like, I'm putting my head in a telescope, right? You're doing something. But if you're calm and just hanging out with your head out here, your body has something called a righting reflex. And it's in the back of your neck. It goes up and down your spine. It's the thing that makes your head not fall to the ground.
Right.
How you see that is in a bus when you watch someone fall asleep, or a car, you know, and they start to go down and they're like, oh, and their head jerks up. It's called a righting reflex. It's to keep you from falling on your face because the body is so smart, right?
Yep.
So he's stuck in a perpetual righting reflex that his body is getting attuned, like, hey, you're going to fall. And then the muscles on the neck lift, the toes lift, and there's a little, so it's almost like every moment is a little bit of like, oh my God, oh my God. And that's why we call it tension.
Yeah.
Sometimes people are amazed. They're like, wait, you know, if I get my head over my body doing static back or levator stretch, you're going to tell me that my hammer toes are going to start to go away? what a crazy idea. But yes, because they don't need to hold up your whole body anymore. I mean, this man has no gluteus maximus. He could have
Right.
a little bit more butt and his calves could do a little less. He's probably a shuffler, I imagine, or he's a strong right leg person. But the toes, go look at your toes, everybody. I want everyone to look at their toes today. Go see what they do. Go see what they do. I always tell you, look at kids. Look at kids, look at toddlers. Where do they fall? Wherever they're looking. And when they start running, right? You know that one, Dr. Reese. The kids are running, they're toddlers. They're running so fast, and everyone's going, oh my God, I hope they don't fall on their face. But they're smarter. So right when they fall, they go, oh, I should just sit down. And they sit down on their diaper or their butt.
Right.
Where us grown-ups go, no, I think I'll hold on to the earth with my toes till the very last second, and then I'll fall and break my hip.
Right.
Like
Right.
it's a startle, it's stress, it's 911 all the time. And most of us are like, but wait, I'm relaxing. I'm just standing here. What are you talking about? I'm not working that hard. So
Yeah.
yeah, everything's
Get this man some postural therapy.